Hey there, it's Dave Hompes with you again. On to video number 2 of this 4-part video series. And in this video, we're going to talk about something called the vitality scale. The vitality scale is something that I actually kind of stole, but not in a bad way, from one of my mentors, Paul Check. Paul teaches it in a slightly different way than I do. I've kind of adapted it to fit the Hompes Method model. And what the vitality scale does is it just helps people understand that health is not black and white. It's not about sickness and wellness. It's not about being ill and then feeling great as complete opposites. It's about helping them understand that their health generally deteriorates as they gradually slide down this scale. As I say, it's called the vitality scale. And I want to go into a little bit of detail about it and how it fits in with the general Hompes Method philosophy. So, we talked about the 7 areas of health and how symptoms develop in clusters, in a mishmash in the 7 areas of health for many people. They might have some digestive issues, they might have low energy, their moods might be imbalanced, they might not be sleeping very well, menstrual cycle might be messed up, there might be some skin issues and so on and so forth. Well, that generally happens, those symptom clusters develop because people go from an ideal level, which is somewhere around an 8, 9 and a 10 at the top of the vitality scale, and then they gradually, for whatever reason, drop down into 7s, 6s, 5s and beyond. Now, of course, it's an arbitrary scale. It's not going to be exactly the same for every person, and it's not 100% accurate, so I only use it as an illustrative tool to educate my clients and patients on this. So let's just, for example, think about a number 10 or a number 9, which is kind of health mastery, if you like. These are the people who are walking around not really having any symptoms at all. They generally feel really good, high energy levels, good moods, they sleep deeply, they look healthy to the outside observer, their thinking patterns are great, they don't do too badly with stress, they just generally kind of walk around and feel good. How many people do you know who are in that space at the moment? Because I don't know that many. I know that many of my friends, even my colleagues, talk to me about various nagging, niggling complaints that they might have, and probably not that many people in this space at all, but that's where everybody says they want to be. Once you get down to sort of an 8, maybe a 7.5 or a 7, this is where you might find that symptoms start to develop. They're probably going to be very mild. You might feel a little bit of a low energy drop now and again. You might find that sleep becomes a bit disrupted. You might get a few murmurs, maybe a little bit of pain in the digestive system. Little minor things that aren't too much of a problem for people. Once you get down below a 7, that's when you start to get what I call nagging symptoms coming in between a 7 and a 6. That start to bother you a little bit, that start to bother your clients and patients, where they're actually starting to think, actually, I don't feel that well. It really concerns them. Cravings, digestive pain, bloating, mild skin conditions, not being able to sleep through the night, feeling anxious and depressed and maybe having a bit of a yo-yo in terms of their moods, maybe getting a little bit of chronic pain in the back, in the joints and all these different symptoms. And if they don't do anything about it, and let's face it, and being really honest, people don't tend to do much about it when they get to a 7, because when they go to the doctor kind of just says, everything's fine, because there isn't really anything that the doctor can diagnose at that stage. There may be a prescription of maybe some painkillers or maybe some heartburn drugs or something like that, but there isn't really anything much going on for the doctor to be able to say, well, here's a diagnosis, here's a treatment, because there isn't really anything tangible for the doctor to type into the computer or use his or her education to prescribe drugs for, or certainly not surgery. So left unchecked, without dietary modifications, without lifestyle modifications, and really finding out what's going on in a person's body from a structural or biochemical perspective, we don't really know why people are descending the scale. But we do, but it's lifestyle and nutrition and other things, stress and things like that. But they don't know that, and the medical system doesn't teach that. So it goes left unchecked. Now, they may also go for coffee with their friends or go to the pub with their friends, go out for a meal and say, look, do you do you have these symptoms? I'm getting a little bit of heartburn and I feel this and then they go on and list all their symptoms and the friend says, yeah, I get that. Or the friend says, no, but I do have a little bit of this and a bit of that. And I talked to Johnny down the road and Mrs. Jones and she has a bit of that. And so everybody kind of thinks it's normal. There's a societal belief that it's actually normal to feel kind of unwell, which is a bit weird, wouldn't you agree? Because I don't think we're meant to feel that unwell. Now, in some of my advanced programs, I teach some of the spiritual meanings behind symptoms, and we will go into that in a little bit of detail in the functional medicine training. But I believe symptoms are there to get you back on course. They're a message, a signal from your body, from your nervous system, whichever system we're talking about, to the conscious mind to get you to live according to your life's mission and purpose. But on the way, we can certainly use lifestyle and nutrition and functional medicine to pull people back into balance to help them get to where they need to go. But it's a little bit more of an advanced concept. By the time people are dropping down to a number 6 or a number 5, they're really not feeling that well, and there may be a medical diagnosis. There may be a cluster of symptoms, but there's 1 or 2 symptoms that stand out more than the others. So they might feel depressed, but at the same time they might not be sleeping very well. They might have some digestive murmurings, they might have some chronic pains, but they get diagnosed with depression and treated for depression. Or, for example, they might have really bad heartburn. They might feel a little bit down or anxious. Again, they're not sleeping well. There may be some skin rashes. Because the heartburn is the thing that's bothering them most, they get diagnosed with acid reflux or gastroesophageal reflux disease, whatever label it is that their particular doctor wants to place on them, and some kind of medication is given. Actually, at a 5, you might find that people are on multiple medications. They might not be on them all the time, but they might be thinking, well, if symptom X is bad today, I'm going to take this drug. If symptom Y is bad tomorrow, I'm going to take this drug. And they start to get a collection of medications in their cupboards. At around this level here, 6 to 5, this is where I like to teach my clients who have things like parasites and bacterial overgrowth, fungal overgrowth, candida, things like that, in their digestive systems, that they're already there. By definition of having those bad bugs living in their system and their body's not being able to deal with those bad bugs, I tell them, look, you're already down at a 6 and a 5. They ask, well, how have I dropped down to a 6 and a 5? And I say, well, over time, years, possibly decades, multiple decades in some cases, they've been under a lot of stress. They haven't been eating well. They're not really doing the appropriate level of exercise. Their lifestyle's not really congruent with what we would want to teach and how we want to try and live our lives ourselves as people who are promoting health. And so over time, they've developed nutritional deficiencies. Their immune system isn't as strong as it needs to be, and all of these different things. And so the bad bugs get in and cause problems. And once they get in there, they're very difficult to get rid of by the person's own immune system, and they start to create more problems. So once you start to have a whole bunch of bad bugs in the gut, for example, that's when things can start to escalate. And that's one of the reasons why I do so much work on helping my clients heal their digestive systems as a priority. And we're going to talk about the links between the different systems in video number 4. And in video number 3, the next one, we're going to talk about the bad stuff and good stuff seesaw in a little bit more detail. So by now, these people have bad bugs living in their body because their immune systems are not strong enough. Their toxin levels will increase, and then that's going to, again, create more of a snowball effect, a cascade effect, a domino effect that leads to more and more dysfunction. At the same time, their digestion's going to be dysfunctional. They're not going to be able to absorb nutrients from the food that they're eating. They're going to get gradually less and less nutrients in the body, depletion, and you're going to start to find that they possibly even start to descend the scale faster if they don't stop and do something about it. And by the time they get down to a number 4, they've got some kind of clinically diagnosed disease. Could be high blood pressure, could be insulin resistance, and possibly the early stages of type 2 diabetes. They might have ulcers, they might have real significant irritable bowel syndrome. They might have been diagnosed with migraines. They might have a chronic skin rash. You know, they could have chronic aches and pains that are called arthritis, myalgia, and all this stuff gets diagnosed when people get down around a number 4. Further down into 3s and 2s, you're looking at the serious disorders, the diseases, you know, MS, heart disease, autoimmune diseases which are rapidly on the rise because there's too much bad stuff in the environment getting into the body and not enough good stuff to help deal with it. So you get this immune dysfunction that creates lupus and multiple sclerosis, ALS and all these other fancy names that people are diagnosed with these days. And then, unfortunately, you know, what's going to happen here is people are going to be treated with more and more drugs. And whilst those drugs might knock out one symptom, they create more symptoms. Every pharmaceutical drug has a list of potential side effects, and what you basically do is rob Peter to pay Paul when you take medications. Down at 0, you might not be able to see it quite on the video here. I've put RIP, rest in peace, because that's when people die, okay? So it's kind of a macabre and negative thing to be talking about, people dying in this way. So I want to put it into a little bit of context with Hompes Method. And what I want to state is that generally, in the Hompes Method, we like to help people who are here. I'm not a medical doctor, so I don't want to diagnose and treat illness. I want to look at people's clusters of symptoms and then teach them that I can help them ascend the vitality scale back to where their symptoms start to dissolve and go away. But I'm not treating anything specifically. I'm helping elevate their vitality. And I do that by removing the bad stuff and getting the good stuff back into their bodies, as you're going to see on the next video. So this is where we like to work. We like to get people up to at least a 7. And that can be a really big gain for people if they start down at a 4.5 or a 5. Huge gain for them. I don't particularly choose to work with people who are down here in what I call the red zone, which is 4s and below. Now, that's not to say that the principles I teach can't be applied to people in this area, but I tend to refer on to medical professionals, people who have a license to be able to treat those specific conditions through integrated medicine rather than trying to deal with them myself. But the principles are still effective at this level. Because if we use the concept that people are dropping down the scale because of their environment, their lifestyle, too much bad stuff and not enough good stuff in the body, the same process applies. It just takes longer oftentimes to get them from here and to bring them all the way up to where we want them to be. Okay. That's basically functional medicine. It's a combination of lifestyle modifications, it's nutrition, it is lab testing to figure out what good stuff is missing and what bad stuff has probably caused it to go missing, the foods, the bugs, the toxins, the nutrients, the hormones and what have you. And as I said in the previous presentation, you know, when you start to get people to just arbitrarily climb the vitality scale, the symptoms in the 7 areas of health just melt away one by one. My headaches are not so frequent. Oh, I've got more energy. I'm sleeping through the night. My skin's clearing up. My moods are more balanced and even, and I don't notice that I've got this muscle and joint pain anymore, and my menstrual cycle's working better, and I'm not feeling moody, and my periods are not painful, and I'm either gaining weight or losing weight depending on which direction I want my weight management to go. That's the kind of response that we get from clients. Now, this is not to say that the medical system is not valuable. If we go back to the 1800s, doctors used to look at patients who had weird and wonderful illnesses, and they used to say, oh, you're being exposed to vapors that you're breathing in. And they used to say, you know, move house, go and live somewhere else. And the people didn't get better. And so we didn't really have a theory back then as to why people, or a proven reason as to why people were getting ill. And we've got to remember that's not long ago, you know, 150 years there and thereabouts, where people were still dying when they were 40. Mothers were still dying giving birth. The infants were dying young through infections. We had this society where the life expectancy was like 40 or 45 years of age. Then came germ theory. Germ theory was all about looking at bad bugs getting into the body and realizing that a lot of people who were dying weren't dying because they were being exposed to these vapors in different areas where they were living, but it's because they had stuff in them that was killing them, you know, bacteria, particularly bacteria, parasites and what have you. And so Pasteur and Jean-Claude Bernard came along, excuse me, just Claude Bernard came along. Then we had the escalation of this germ theory where it kind of changed the paradigm of Western medicine. And it said, oh, we can name something now that's killing people. we develop chemicals that can actually knock out the cause of those illnesses, which is the bugs. Antibiotics were born. And so we can name the problem, we can blame it on the bugs, and now we can tame it. So we stuff people full of antibiotics, and miraculously, almost overnight in terms of our evolutionary and societal history, the life expectancy of people went from 40-something right up to about 70 because we were able to knock out these bad bugs. And that's amazing. So nobody's going to tell me that the medical system hasn't substantially benefited society. We have too many natural healthcare practitioners bad-mouthing and blaming and hating the medical system, and that's completely unfounded. What we need to do is synthesize the two, not be at loggerheads with one another. That's just a little bit of my high horse stuff kicking in there. Now, where was I going with this? Whilst antibiotics and germ theory really improved and changed the paradigm and helped people live longer, it also created a major problem. And that major problem is that we were living longer. And in itself, that's an issue, because the longer people were living, the more weird and wonderful symptoms and new diseases started to kick in, particularly as we started to invent more chemicals to put in the environment, as we started to process foods more, as the level of stress or perceived stress, societal stress, increased in our lifestyle. And so what happened is people living a lot longer, the medical system didn't adapt. So all the chronic symptoms, the chronic diseases that people are walking around with, all the symptoms in the 7 areas of health, all the chronic diseases that are down here that people kind of get told they have to live with, are a consequence of actually developing an entire medical model based on germ theory. So name it, blame it, tame it works when people have acute infections that might kill them. Let's develop chemicals to knock out the bugs. But now the entire medical system is based on name it, blame it, tame it. And that doesn't work when people have clusters of symptoms in the 7 areas of health. So whilst we went from a life expectancy of 40 to 70 through this miraculous innovation, which was antibiotics, a whole bunch of other drugs that really do a pretty good job of suppressing symptoms, because the symptoms are blamed on something tangible that the doctors can find, or a disease or a label that can be hung on people, but the root cause of the problem is never actually found. And that's what we do with functional medicine. When we look at the bad stuff, good stuff seesaw in video number 3, you're going to see why the Western medical model doesn't work, where its frailties are. But please don't ever quote me as bad-mouthing the medical system, because we went from age 40 to age 70 in terms of our life expectancy in a very short space of time with germ theory. But the germ theory doesn't adequately help people who are descending the vitality scale. And what we're able to do is arrest that descent wherever it may be, wherever we choose to work with people, whether it's just within the 7 to 4 bracket or the 4 and below bracket, and we can start to help them ascend that vitality scale once again. And that is what functional medicine, and that's what the Hompes Method training is all about. So my name is Dave Hompes. I hope you've enjoyed this video. Looking forward to joining you again on video number 3, and I will catch you very soon. Thank you.